Faculty, staff, and senior leadership all rolled up their sleeves on September 19th to take part in Duke Medicine's second flu vaccine blitz. The ambitious effort to give flu shots to thousands of healthcare workers in a single day expanded beyond Duke University Health System this year to include 10 hospitals, clinics, and health departments across 2 North Carolina counties. The goal is to provide flu vaccines to as many as 10,000 healthcare workers in a 24-hour period.
The vaccine takes at least a couple of weeks to have any sort of serious impact to your own immune system. So you want that couple of weeks to be finished well before any flu comes into your community. So even though we don't have flu here now, fortunately, we're still interested in protecting our staff now such that they're ready as a group for when flu arrives.
The flu vaccine blitz will also serve as a drill to test the hospitals and clinics' abilities to handle a mass vaccination effort in the face of a disease outbreak. Duke launched the blitz last year, vaccinating more than 8,000 healthcare workers in one day throughout Duke University Hospital, Durham Regional, and Duke Raleigh hospitals, plus affiliated community and primary care practices throughout the Triangle.
It really gives us a chance to test our communication, to test our logistics, and to test how a large hospital system would actually work if we were challenged with a real emergency. Could we reach out to all of our staff in 24 hours? It's actually harder than it looks when you've got 30,000 staff.
The effort was instrumental in the hospital system achieving a better than 80% vaccination rate among staff during last year's flu season. This year, the flu vaccine blitz has spread to other community partners and health centers. Health departments in Durham and Wake counties will be participating, along with other hospitals and community clinics.
I think you take on a certain health obligation when you're an employee in a hospital to do everything that you can to protect the care of the patients who we look after. And so we as an institution want to do everything we can do to stop flu coming into our hospital. And so if that means vaccinating our staff as a protective, safe measure, then that makes sense, and that's why I think people should do it.
Flu is an avoidable and often dangerous illness, causing greatest risks to the very young and old, pregnant women, and people who have chronic illnesses such as asthma. Duke doctors urge everyone in the community who is eligible should get a flu shot this season.